let's get a little more concrete here as we've talked about neurodiversity, we've talked about kind of the movement behind it. So what are we actually going to do with this? I'm like a super practical person. And so what does it mean to have neurodiversity affirming practices? So the first thing is you got to check yourself, right? So you have to think about your own implicit bias, your own perceptions, what you think may be what this child needs or this family needs to be happy and healthy may not be what they actually need. And you need to understand that you don't always know exactly what's best, so to speak. I had a family once that's not a neurodiverse individual, but who told me, it was early in my career, I was getting all these recommendations. I thought, oh, here's all these resources. This is going to be perfect. And the mom looks at me and she goes, Dr. Moody, I know you know what's best, but maybe I know what's better for my family. And that really stuck with me, like, yes, here's what the evidence says. Yes, here's all of these, services. But if it's not going to work for the family or the individual, then, maybe that's not the best path. So that active collaboration piece is huge with the family, listening and learning from lived experience. I'm such a visual learner. I think that's why I love all of the social media, Instagram posts from, Neuro Wild and Little Penguin Studios and Autism Sketches and all of the other ones that I have in my presentation, because it just kind of like is aha moments for me. And it's really helped me, really understand my daughter and what her lived experience is. And then really thinking about, okay, so we're all here because we're all probably wanting some neurodiversity affirmation, right? So we're already embracing those differences. We may or may not have already had some of these like internal reflective moments about our biases and what we think is best versus what the patients know is better for them. So really thinking about how we can advocate and teach our patients and neurodiverse individuals or ourselves how to advocate for ourselves, to know what the strengths are, to know what we can build on in order for folks to have that improved quality of life that we're really looking for. So really, again, challenging the assumptions of what is normal and what is needed for a person to live well, and really focusing in on the accommodations with a focus in on dignity and self-determination for these kids.